Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Some people may put off surgery of the foot and ankle because it seems like such a big operation with a lengthy recovery. But some procedures can be done in a minimally invasive way. Here to talk about these options is Dr. Eric Bellinger. He's an assistant professor of orthopedic surgery at Upstate, specializing in surgery of the foot and ankle. Welcome back to The Informed Patient, Dr. Bellinger.
Thanks for having me.
I'd like to start by asking you about bunions. Can you first describe what a bunion is and who it's most likely to affect?
So bunions are a deformity of your big toe in which your big toe deviates towards the rest of your lesser toes. And that deviation and the way that the deformity occurs causes you to have a bump on the outside of your foot that often can be painful, particularly with certain shoe wear.
Now, is this something people are born with, or is a bunion something that develops over time?
It can be either. So some people are born with bunions, other people it can develop over time. It sort of depends on the clinical situation.
Does it affect men and women equally?
It tends to affect women more frequently than men, pretty significantly, actually. It does occur in men, but much more common in women.
Is that due to high heel wearing?
Some of it's high heel wearing, but also there's just from a physiologic perspective, women are just more prone to developing bunions from a soft tissue standpoint.
So what problems do bunions present for patients?
Bunions most frequently present the problem of, as I mentioned, there's a deformity. So there's a bump on the inside part of your foot that often will rub in certain types of shoes, which can be, very problematic to patients, particularly ones that have to wear certain types of shoes to work or what have you. But there can also be issues as the toe starts to kick over. It can start to rub on some of your other toes and cause some of your other toes to develop a deformity as well, such as hammertoes.
And I want to ask you about hammertoes specifically too. There's a lot of over-the-counter devices that say that they can, fix bunions. Do they work?
So I always tell people it's not going to correct your deformity, but it can help with the symptoms that your deformity is potentially causing you. So, some of those over-the-counter bunion splints or toe spacers or things like that can help cushion the area so that it's the big toe is not rubbing on the other toes, or the bump on the inside of your foot is not rubbing on your shoe quite so much, but it's not going to get rid of the deformity for you.
Let's talk about surgery then. Will that provide a lasting fix?
Yes, surgery oftentimes will provide a lasting fix. There is a small risk of recurrence, just like with any other type of surgery, but oftentimes surgery can, provide patients with good relief from this and sustained correction of the deformity.
Can you compare a traditional open bunion surgery with a minimally invasive bunion procedure in terms of what patients can expect?
Sure. So minimally invasive surgery, not just in bunions, but minimally invasive surgery in general in foot and ankle has been devised in order to try to help patients with their post-operative period, utilizing smaller incision, less surgical dissection, typically faster recovery times, less swelling, hopefully less pain, also using smaller incisions, so better cosmetic results.
Is everyone a candidate for minimally invasive?
Not everybody's a candidate for minimally invasive surgery. So bunions come in many different varieties and different amounts of deformity. And there are certain types of bunions that are amenable to minimally invasive treatment where others are not. I do try to, if a patient is a candidate for minimally invasive, that's certainly my preference for all those reasons that we just discussed. But not every bunion can be treated in that manner.
What are the expected side effects and how common is stiffness with the two methods? If you do minimally invasive, will you have to deal with more stiffness or less?
Typically with minimally invasive, the stiffness is less of a problem because it's less of a surgical dissection. So I tend to find that my patients that I can treat minimally invasively have less stiffness, at least initially, than my patients that I treat open. Now, I would say that oftentimes they will get to the same place at the end of their recovery, but at least initially, I think the range of motion is certainly better.
What are the risks with each type of procedure?
The risks are similar in terms of you're still having to cut the bone and to create the correction of the deformity. So you still have, risk of that you would have from cutting the bones, but the wound healing and chances of infection are lower just because you're making smaller incision and again, less soft tissue dissection and things like that.
What about other foot deformities, like you already mentioned hammertoes? Can you describe what those are and how they can be fixed?
Hammer toes are oftentimes a result of a bunion deformity, although not always. Those can be treated in a minimally invasive fashion using small incisions to correct those as well. Again, you're typically having to remove some bone, so there is, some recovery associated with it, but typically you can use a pretty small incision, and that will also help with your postoperative recovery from that standpoint.
So is the hammertoe the pinky toe?
Hammer toe is any of the lesser toes, so the second through fifth toe. And it's a flexion deformity that often develops, as I mentioned, as the big toe starts to drift over and it kind of starts to push the other toes up so that they curl up on themselves.
So if a person has developed hammertoes in response to their bunions, can you do a surgery and address all of those at the same time?
Yeah, typically you would address them all at once. You can't typically fix a hammer toe if there's a bunion deformity present as well, because if you just tried to fix the hammer toe by itself without fixing the bunion, it's not going to work because it's just going to recur.
All right. What about high arches?
So high arches is a complex problem. It's certainly not as common as people that have really flat feet, but high arches can be just as much, if not more of a problem than flat feet. I see a fair amount of patients that have pathologically high arches that, certainly there's a lot of different treatment options, including different types of arch supports, physical therapy, bracing, and things like that, that we can certainly try. However, if it fails all of those types of modalities, certainly surgical options are available, including minimally invasive. Now, I would say there's only parts of a procedure that we do that would be minimally invasive as part of a deformity correction. So not the whole surgery is able to be done through a minimally invasive approach with the high arch correction, but we can certainly do parts of it minimally invasively.
Is the problem with high arches, does that cause pain for people?
Yes, it certainly can cause pain, typically up around the ankle or on the outside part of their foot.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with orthopedic surgeon Eric Bellinger about minimally invasive techniques for some surgeries of the foot and ankle. Let's move into the ankle and talk about Achilles tendon repairs. What type of Achilles tendon injuries do you see most often?
Most frequently, Achilles tendon injuries occur in what we call the mid-substance or the mid portion of the tendon. That typically represents an area of the tendon that does not receive a great blood supply. And that's the reason the tendon tends to tear there. And I would say 90% of tendon tears occur in that region.
Is it mostly from athletic injuries?
Oftentimes it's from an athletic injury, although it can certainly be from something even as benign as taking a wrong step going down the stairs or something like that.
What's the typical age of a patient with a tendon injury?
Typically see in between 30 and 40-year-old patients, but it can really occur at really any age.
How often is surgery warranted?
So you can treat Achilles tendon ruptures either non-surgically or surgically. There are certainly advantages and disadvantages to both, and there's quite a nuanced discussion about that, but depending on the clinical situation as well as, patient factors, there you can really treat these in either manner.
So some people might opt to not deal with the surgery. Does that mean that they're always going to have some weakness on that leg?
I tell people no matter which way we go, there will be weakness in that side. The surgery doesn't save you from that either. It's certainly a discussion, and you know, you can have, like I said, weakness either way. The surgery, if you look at the studies that have been done, these studies would tell you that the amount of weakness that a patient has long term is about the same whether you have surgery or not. But I would say, just from my experience and my practice, people that have the surgery tend to recover a little bit faster than the patients that don't have surgery.
What is the surgery for a rupture? Are you connecting two ends that have torn, or what are you doing?
So I'm connecting the end that tore, that's the more proximal end, or the end that's further up the leg that's attached to the calf muscle, and I'm reattaching it down to the bone itself, so down to the calcaneus, and that offers me a stronger repair and allows me to use smaller incisions to do so.
Are you stretching it further than it normally would have stretched?
Nope, I'm stretching it about the same length, but I'm tensioning it to the actual heel bone itself instead of trying to sew the two ends together. When you try to sew the two ends together, I tell people it kind of tears like a mop. So it would be like trying to sew mop ends together. So if you can do the method in which I use, it allows you to kind of get better purchase within the tendon with your repair and fix it to bone, which is obviously much stronger.
What do you tell patients to expect during recovery after surgery?
So the first couple of weeks, I still do keep you off of my repair to allow the incisions to heal, but then we quickly get you into a boot and start the rehab process pretty quickly, usually within 2 weeks or so.
So how easy is it for you to tell which patients have followed your orders to stay off their feet and which ones have not?
I can usually tell pretty quickly.
Well, now you offer minimally invasive techniques, but I'm guessing not every orthopedic surgeon does.
Correct.
Do you have advice for how patients can find surgeons who offer this?
Upstate does a pretty good job of putting that on our website if we offer minimally invasive approaches and such like that. And it certainly is, as we mentioned before in the bunion section, it's certainly patient specific as to who qualifies for the minimally invasive approaches or not. But certainly, yes, not every surgeon offers it. I would advise that, that's certainly something you can ask your surgeon about. But, I typically will opt for a minimally invasive surgery if it's available to a patient.
And again, that may depend on the injury itself, and it may depend on the patient themselves and what other medical issues they may have that they're dealing with, right?
Correct. Yeah, there are a lot of factors that go into that decision-making process.
Well, thanks for taking time to tell us about this, Dr. Bellinger. I appreciate it.
Thanks so much for having me.
My guest has been Dr. Eric Bellinger. He's an assistant professor of orthopedic surgery at Upstate and a specialist in surgery of the foot and ankle. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.